And I would like to use this opportunity to pay tribute to thank them all, thank Dr. Kavita and also Dr. Balamurali and all the doctors who saw me, for the service they offered. It's a hospital which I would, without hesitation, recommend people to Chennai for medical checkup and treatment as appropriate. Thank you very much. So now, Vinay, I'll leave it to you now.
Thank you, Parsuramen. Dr. Balamurali, we're talking about a healthy brain, healthy spine. More about it.
Sure, sir. First of all, I'd like to thank Dr. Armoogum Parsuramen for the invitation. And it was nice to see you last week in Chennai, and now we are connecting digitally from Mauritius. And thank the Global Rainbow Foundation for the entire summer, and for Dr. 𝐁𝐿𝐴. Am I
we are hearing you, Dr. Bala.
Yeah, okay, fine. Good. Now the topic that we have chosen is spine and brain. Very, very
Unfortunately, we are having some technical issues. Can you hear us, Dr. Balamurali?
I can hear you very clearly.
Great.
Okay, please
carry on.
Yeah. Okay. Dr. 𝐁𝐿𝐴, can you hear me?
Yes, we can hear you.
Yeah.
Please.
Well, okay. The topic about the spine and brain health is something very, very important. Only because the basis of many things about our mobility, about our health, comes from the spine. Doctor, if we can mute everyone.
Yes, we have muted. I have muted. What about
I think we can mute Vinay as well. Yeah. Okay. Fine. So whenever anybody wants to talk, if we can switch on, then maybe that echo may reduce. Yeah. And now I have no echo. Now it's very clear. Okay. So the spine is the basis of our mobility. So spine problems are the second most commonest problem in the world, apart from common cold. So most people have ailments in the spine predominantly because of lifestyle. It is pretty much a lifestyle disease. 1 in 10 people at the age above 40 will suffer from back pain and will require medical treatment. So it is that common. 95% of spine problems are because of lifestyle. Only 5% of spine problems are serious. So if we try and maintain a good, healthy lifestyle, majority of our spine problems get better and are under control. Yes, we all get old. Our spine degenerates. There is wear and tear of the spine, and there is problem in the spine that will happen as we grow older. But if you have good, healthy lifestyle, you're active, you don't put on weight, you follow all the do's and don'ts, and you look after your neck and your back, your old age will be healthy. If at young age, if you're not doing that, your old age, you will be having lots of spine problems. So this is in terms of spine problems in general. And that is why it is very important, because it's such a common problem that we suffer from it, we don't talk about it, we accept it. care of our brain as much as we take care of the rest of the body. And there are simple things that you have to do to take care of your brain. One is, the brain needs rest. I'm just giving you an overview. The brain needs rest. Sleep is so important for rejuvenating the brain. It is like called pruning. Like, you know, when you want a plant to grow well, you keep pruning and you keep pouring water. The same way the brain needs pruning. And the most important thing for pruning is sleep. Is to have a good sleep. The food we take affects the brain. So everything that is unhealthy, oily, fatty, and unnecessary food will also affect the brain. It will affect the hormones and various other things. Our entire body hormones are controlled by the brain. So every single activity in our life is controlled from the brain, which is in terms of whether you are a mother, you want to have a child, you want to breastfeed, to having your periods, for all of these things your brain. For thinking and for male sexuality, male functions, you need the brain. To regulate the temperature in your body, you need the brain. To develop the metabolism in your body, you need the brain. So for your heart and lung health, you need the brain. So the brain is a very essential part of everything, which happens automatically. We don't have to do anything. It just keeps on happening every day, every minute. The brain controls the whole body. We're not conscious when we're breathing. We're all breathing now. We're not saying that, oh, I have to take a breath. We don't think. The brain just functions. It breathes. So you have to take care of the brain. So food, good sleep, and a lot of other things to keep the brain young. So the brain also grows old. As we grow older, we lose memory. We lose our thought process. We abuse the brain in many ways, like alcohol, smoking, food. All these are bad for the brain. And if you do it chronically, it affects the brain. So we need to keep the brain young. By keeping the brain young, what do you do? Apart from healthy lifestyle, you need to do a lot of interaction. The interaction that we do with people, it really helps with the brain. So the more you talk to people, the more you network with the people, the more younger people you mix with, the people that you are, exchanging messages, information, and the feel-good factor. The brain needs a feel-good factor. So brain health is very, very essential, and all of these things are essential for our old age. So what you do in your young age and how you keep your brain young and active at young age will be what your brain will be at old age. So I'm just kind of summarizing the importance of the brain and spine, but there's a lot more we can talk about. Thank you.
Yes,
You can unmute this.
so whenever a person comes with a problem of spinal cord injury or brain injury, the first person to see is Dr. Bala. So he sets all the emergency problems, like if there is a fracture of spine, he stabilizes it. If there is a problem in the brain, he sits right in the emergency setting. But after that, the disease will have an impact over the person, like he is not able to move his body, he has a problem with his bladder, bowel. So in that case, the concept of rehabilitation comes in. So we, as the neurosurgeon Dr. Bala and as a consultant in rehabilitation medicine, we closely work together. So rehab is the person has an impact of disease, and we have to recover his potential and improve the quality of life. So that is equally important. So that is where the rehabilitation medicine comes in. So for example, a person with a spinal cord injury will have the problem of not able to move his limbs. He is not able to perceive the sensation, and he will have a problem with his bladder, bowel. So all this has to be taken care of. So where the rehabilitation plays a major role. And the rehabilitation is a team effort, where the physiotherapist, occupational therapist, speech therapist, and then prosthetics and orthotic technician. So all these team has to be coordinated by this specialty of rehabilitation. So
work as a team. Likewise, the problems in brain is a different spectrum. Like mostly the persons with brain injury will have cognitive deficiency where they'll not be able to recognize where they are, and they have memory issues, and they'll have problem with their speaking, and then they will have if they are treated with tracheostomy, then we have to tracheostomy is putting a hole for the trachea for their breathing or respiration. So all this has to be managed. So rehab medicine is the one which improves the quality of life who has the problems with their brain and spine.
Dr. Parsuramen, allow me to ask, you were mentioning that this is the second most common problem when you were talking about spinal cord issues. Is it not a matter of concern?
Sorry, yes. Just repeat your question again, please.
Sure. You were mentioning that spinal cord issues, it is the second most common problem in the world. So it is a matter of concern. You would agree with that?
Yes, yes, definitely. I mean, what I'm talking about here is people who suffer from back and neck pain. And that is the second most commonest reason for hospitalization and problems worldwide. There are two spectrums of the spine. So one, as I said, is 95% people develop problems related to wear and tear, degeneration, aging process, all of these. The serious problems are very rare. What Dr. 𝐁𝐿 mentioned about rehabilitation that is required for patients. These are serious problems like spinal cord injury, spine tumor, and country like India, the sub-Asian continent. We have a lot of tuberculosis, which is very, very commonly affects the spine. So these are more serious problems, but they are very small. They only account for 5% of the problems. So I want the general public more think about the commonest problems is how to take care of your spine. Obviously, the other problems are because of accident or infection, which we need to take care of. So I think we can focus on both these things separately so that we are not confused. So how to prevent back and neck pain is very important, and how to have a healthy lifestyle, and what to identify when to go to a doctor, when is a surgery or any treatment required is a separate thing, and the other spectrum, which is serious problems, is totally different.
So you mentioned for a healthy brain, food is very important. So you mentioned also that oily food, it can affect the brain. Could you please elaborate on that?
Yeah. So I think what we eat is what we are, the whole body in general. But the brain has certain chemical transmitters. So there are good hormones and bad hormones. There are certain hormones that are triggered, which make you happy, which bring in a lot of energy, a lot of adrenaline. These are called happy hormones. So certain foods stimulate these happy hormones, and it makes you feel good. Your thought process is positive. Your attitude is positive. You are clear in your thought process. You are thinking right. You are able to function. Your higher functions of your brain are very good. Whereas there are certain foods which trigger the bad hormones. So what I mean by bad hormones is they make you lazy, depressed, anxious, lethargic, and it reduces the function of the brain. By reducing the function of the brain, it reduces the function of all the things in your body. It actually
does that mean that food, it can create like a feel-good factor in your body?
Definitely. The food that we eat, it is not only food, it is the chemicals that are there in the food, the water, the nicotine, the drugs, the alcohol. So all of these things, I think, in terms of, so all of these things have some effect on the brain, which creates a different effect of the brain. And because of this, if you do it once in a while, it's different. But if you do it regularly, you abuse the brain, then it does cause some serious problems.
Professor Parsuramen, you were in India last week for 20 days approximately. You visited the Kauvery hospital in Chennai, as you mentioned earlier. So tell us about the facilities that were offered there. compare it to the facilities that are offered in Mauritius?
Thank you very much, Vinay. I would not like to compare, and I would like to say,
sir, I think you're on mute.
Sorry.
Yes, we can hear you now.
Yeah, in fact, when I was in Chennai, I had time to visit Kauvery Hospital and also Hamsa Rehab, and where Dr. Balamurali and the other specialists in Kauvery Hospital and Dr. 𝐁𝐿, I could get an overall, assessment of what is being offered there, and I must say it's very state-of-the-art service that they offer to the patients coming up to them. And so, what I do not compare with Mauritius, but they are very advanced, what I could say, and they are doing, and the work that the service they offer is more important. When people go there, the service they get is, I believe, the very key element in thinking over to the people. A welcome center.
So the emphasis is a lot on the quality of the service.
Quality of the service, affordability of the service, and this is what I believe is a great asset for the hospital, both Kauvery Hospital and also Hamsa Rehab. These are two entities, right? That Dr. Balamurali, he had the Hamsa Rehab and during department in Kauvery Hospital.
Maybe you can hear Dr. Balamurali. You can talk about Hamsa Rehab. Tell us more about it, sir. What are the services that are offered there?
Sure. See, I trained as a spine and neurosurgeon in UK, in London for almost 15 years. And when I returned back to India, one of the things that I realized that a country like India, where lifestyle disease accidents are so common, and for our population, we have a lot of road accidents, a lot of falls from construction sites. The safety is not as Western standards. So there is a lot of trauma that I was seeing. So when patients had a spine surgery, they're paralyzed, when they have brain injury, stroke is very, very common because India is the diabetic capital, the hypertension capital, the heart attack capital. So, we have a lot of, major trauma and major injuries. Yeah. So because of this, we see that there is a lot of, very serious neurological problems. So when these patients have surgery or they have acute care, they do not have a place where they can go for rehabilitation, which is a very, very important aspect of recovery. Because the surgeon can only fix the spine or fix the brain, can remove the blood clot, but the damage is already happened. So rehabilitation is something in a country where we have advanced medical care, acute care, is unfortunately not there. So that is when I decided that we need to get a service for rehabilitation, and Hamsa was born. So in Hamsa, we take care of all kinds of patients with spine injury, brain injury, stroke, neurological rehabilitation, pediatric problems like cerebral palsy, autism, special children, all multiple disabilities, post-operative care. For example, people who have knee replacement, hip replacement, for a small island. So I think, it's very important to take the message across that acute care is only one half of the treatment of the problem, and without rehabilitation, the outcome of all these things will not be good. So I think that is what is our our vision and vision is that we want to create an affordable care because this is a problem of the middle income and low income. Stroke may be a problem of the higher income, but the accidents, the falls, all these happen with people who are on two-wheelers, who have a middle income. They are the single earning member. They're mostly men. So if they are not put back into the society, the entire family is affected. So it really is an economic problem as well for the country. If you have a young generation of people who are not going to be working and not productive on wheelchairs and bedbound, then in going forward, we lose good talented people. So I think that's what we are focusing at Hamsa Rehab.
Yes, Professor, we got Parsuramen. So Dr. Balamurali was talking about the Global Rainbow Foundation.
Yes, and I must thank Dr. Balamurali. I must thank Dr. Balamurali and Dr. 𝐂𝐿, who facilitated an MOU between Global Rainbow Foundation and Hamsa Rehab, whereby we conduct telemedicine service to Mauritian patients, and this has, I must say, has a very good effect on the welfare, the health of the patient. If I take one example of somebody who was advised to go for head operation, which is a very sensitive one, but following the consultation by Dr. Balamurali, that patient did not go for the intervention and is very well. We met him yesterday with Dr. 𝐂𝐿, and he was really very happy and grateful for this sound and timely medical advice. So this is one example of the collaboration we have, that there has been between the Hamsa and Global Rainbow Foundation. We've conducted many telemedicine services to patients in Mauritius, and for them, getting that expert advice on health issues for which they were not given the right sort of guidance in Mauritius. That was a very useful contribution, and it has helped many people in evolving their health condition. But also, I must say, Dr. Balamurali, that the person who came to the Hamsa Rehab, right, where you treated that patient, did the surgery, that the lady, and then after you completed the surgery part, she was worried about rehabilitation. As you rightly said, it's not only the surgery, but the rehab is very important, right? And this is a common problem in Mauritius, I must tell you. Today, this morning, Dr. 𝐂𝐿 saw a patient who was just amputed a month ago, right? Amputed, he is sent back home. There's no aftercare, no guidance for him. And I was talking to the patient this morning. His left foot, his right foot was amputed, below knee, fortunately. But the right foot, the way I see it myself, not being a doctor, but I have experience with patients amputees, he's at risk, And so, but he didn't get that sort of advice. That is to be careful about the other foot also, because being diabetic, if he doesn't care for it, he will not be able, he will might soon be at risk of having second amputation. And Dr. 𝐂𝐿 saw him, gave him advice what to do, and we will take care of him fully at our Global Rainbow Foundation Rehabilitation Center, providing to him medical, physiotherapists, occupational therapists, and psychologists service before we gave him his prosthesis. So I would like to say that the patient who was operated in the Hamsa Rehab, was very, very happy with the treatments he got there and the rehabilitation we are providing in Mauritius. So this collaboration between Hamsa and Global Rainbow Foundation can be very, very beneficial for patients with spinal injury problems. So I would like to thank you once again to Kauvery for this collaboration.
Thank you, sir. We are also really looking forward to, and I feel that, there is a lot of knowledge, a lot of experience that we can exchange. I think at the end of the day, the vision of Global Rainbow Foundation aligns with the vision of Hamsa. So we are here to support people, to guide them, to give them the best that we can. And I think, we have experts on our side, you have experts on your side, and wherever there is a missing link, wherever there is, lack of knowledge, we can bridge that gap. And I think we are really committed to that, and we've been doing that over the last 3 years, and with the leadership of Dr. 𝐁𝐿, we have been training a lot of, physiotherapists, nurses, occupational therapists, and this is very important. I can imagine that a country which has so much of advance in terms of health care, and I worked in different parts of the world. I worked in London, in Switzerland, in US, in Vancouver, in Canada, and I would say Chennai has all those facilities which is there in all these countries. But when it comes to chronic care, right, rehabilitation, we are far, far away from the West. So there is a huge, a gap in healthcare systems across the world, and I think that is where we need to link and we need to work together, and that's what is Hamsa, wants to bridge that gap and feels that we need to bring that chronic care, the rehabilitation into mainstream, because that's where patients really benefit. That's what patients want. So this Global Rainbow Foundation partnership will definitely help both of us grow, and definitely we are all the way to support you.
Dr. Lal, well, I think Dr. 𝐁𝐿 will say a few words now, and then I would like to come with some ideas about future collaboration. How can we expand our collaboration for the benefit of the Mauritian patients? Let Dr. 𝐁𝐿 say a few words about his experience in Mauritius now, his visit, and also begin with that person who was cooperated in Hamsa.
But before Dr. 𝐁𝐿, allow me to ask you a question before you answer that. Talk about the experience in Mauritius. How do we create that awareness? How do we make people realize the importance of rehab?
The awareness for rehabilitation should be created by every stakeholder, starting from the doctors here in the private as well as in the government sector, as well as the NGOs like the Global Rainbow Foundation. So all they have the equal responsibility of creating an awareness on rehabilitation, which really gives the completion of the healthcare at the end of the day. So fortunately, I have seen that the people here are very fitness conscious, but the previous generation, the present generation, I would say that in my observation, so their lifestyle, their food habits, all this has to be monitored, because if it is not being taken care of at this point of time, it is going to cause a big health burden for both the society as well as for the government during the coming years. Especially a matter of concern is the diabetes, right? So I would say that there should be a proper awareness, sensitization on healthy lifestyle, food habits, and the periodical early detection of blood sugar, periodical checkups for their blood sugar, and early detection of complications, So all this, there should be a standard operating procedure, both in the public, in the government, as well as in the private sector, which can avoid a lot of complications, especially the amputation, the chronic renal failure. So all these are the complications which is going to badly affect the quality of life. So the rehabilitation has impact, has its significance in every aspect of life, in taking care of their brain, spine, also especially the diabetes, where I have seen that the incidence of amputation is little high for this population. So we have to carefully monitor this, and every person or every stakeholder in the healthcare system has equal responsibility in creating awareness, starting from primordial prevention till the management of complications.
Dr. 𝐁𝐿, how do you relate the brain with rehabilitation? Can you elaborate a little bit more on that?
The common problems which requires the rehabilitation is, as you all know, that a traumatic brain injury, which is a part and parcel of the polytrauma or the road traffic accidents. And now the metabolic diseases, the lifestyle diseases are increasing because of our, again, as I said, the faulty lifestyle and abnormal food habits. So the risk factors like hypertension, diabetes, all these has impact on the brain, leading to a common thing called as stroke, that is cerebrovascular accident. So brain can get insulted by any means because of our abnormal lifestyle practices. So this is how the food, and then what we eat, drink, abnormal lifestyle, and the metabolic disorders like diabetes, hypertension, all these have an impact on the brain, leading to a common condition called as stroke. Unfortunately, the incidence of the young stroke is exponentially increasing, especially I have seen in India. I do not know about the trend in Mauritius. It is all because of the risk factors prevalence, especially the diabetes and hypertension.
And how different or how similar when we're talking about food habits, lifestyle, India, if we compare it to Mauritius?
I think it would be a premature comment as a comparison, as my stay is quite short for 1 week. But I have seen that here you people drink more coca, so which is a highly concentrated carbohydrate, which is not good for your stomach as well as for your pancreas, which can very badly increase the intensity or the gravity of diabetes. So mostly I have seen the amount of carbohydrate intake is little high in your food. That's what my observation is. Like the refined carbohydrate, what you take it as breads, right? And then coca, juices. In this morning when I went for a breakfast in a restaurant, when I asked for water, he gave me juice, fruit juice, which is of high sugar. So I asked, why can't you give me a glass of water? He said, this is our practice. So we have to start the intervention from correcting these practices, which are all very, very simple, but it can give a good positive impact over the disease prevention.
But do you see similar practices in India when you compare it to Mauritius? How similar is it in terms of food habits or the lifestyle in general?
Similarity, we can say that I'm not so familiar with. See the similarity almost. You eat the same. I have been to Indian restaurants where you eat. I have been only to the Indian restaurants, most of the restaurants. I have not seen the real authentic Mauritian dishes. So I don't have any comments about it. But overall, I can say the Mauritian should restrict the carbohydrate intake. So that I can cover.
And I'd like to ask Dr. Balamurali, when we are talking about statistics in terms of rehabilitation, is it mostly women concerned, or is it men? in terms of statistics? What's the ratio? Is it 50-50?
Is this are we talking in terms of back pain problems or sorry, what is the statistics regarding?
Yes, in terms of like rehabilitation, people who visit, the success ratio.
Okay. See, the problem in terms of accidents is more common in men because men are more out in the work. I would say 90% of spine injury and brain injury are common in men, and 90% of them are young men.
90% is quite a lot.
Yes, it is a lot. So 90% of them are men. 90% of them are young men between the age group of 20 to 40. 90% of them are the single earning members of the family. And 90% of them are the only breadwinners of the family and in the middle income. This is a shocking statistics. I mean, this is national statistics, yeah. So this is a serious problem. This I'm talking in terms of accidents and fall from heights, in terms of spinal cord injury and brain injury. When it comes to stroke, so stroke is again more common in men, but equally women. I'm not sure of the percentage, it might be 60-40. But stroke is equally common because stroke is because of diabetes, hypertension, heart attack, cholesterol, lifestyle disease, smoking, alcohol. So these are all the predisposing factors of stroke. So in rehabilitation, we have mostly in any center anywhere in this country or most part of the world, men more than women. The outcomes are equally good. Yeah. So it all depends on how the initial damages. If somebody is completely paralyzed, their outcome is not so good. If they are incomplete, they are partially paralyzed, their outcome is good. Younger people do better than older people. Women and men do equally good. If somebody has a stroke, but they also have had heart attacks, they are uncontrolled diabetic, they have serious other infections and problems, they don't do good as compared to somebody who is a stroke, but they don't have many problems. So the outcome really varies from person to person and the group. But in general, people who have rehabilitation do better than people who don't have rehabilitation. So that's a huge difference. Because some people have stroke and they go home and they just have a physiotherapist or somebody taking care of them who does not know what they're doing. So if somebody goes to a structured rehabilitation program in a center where there is good rehabilitation, they do far better than those who don't have rehabilitation.
And what about, Dr. Balapurani, what about children?
Yeah, so children generally do well. So we don't see that many accidents as in adults. But yes, there's a lot of falls, fall from the bed, fall from height, fall from school, and those things. We have both spine injury and brain injury. And generally children do better in terms of recovery and adapting because they are so young that they will adapt quickly to the environment. So you can train them and teach them new skills which they will accept. Their acceptance levels for rehab is quite high. Whereas adults sometimes are very reluctant because there is a lot of psychological overlay. People are depressed. People don't want rehab. People don't want to sit in wheelchair. There is a lot of factors influence like religion, caste, sexuality, the family circumstance, financial status. There's so many things which overlay in the rehabilitation process because rehabilitation is long and it costs money. And unfortunately, not many government setups have rehabilitation. And people are so depressed because people abandon them. Somebody has an accident and they are bedbound. For a few days, friends and family will hang around, and then finally it just comes down to the husband, wife, or the mother or father, and they're financially broke because they've spent all their money for acute care. When they come for rehabilitation, they hardly have any money. So the acceptance for rehab is much lesser in adults and other people.
And Would you like to talk about your experience on congenital disorders in children and their rehabilitation?
Yeah. So I do as a spine and neurosurgeon, and we have a lot of programs with Rotary clubs in India, and we do free surgery for children with spine and brain abnormalities. So we have a huge international fund. We've operated almost 40, 50 children free of cost who are born with myelomeningocele, which is a spinal abnormality, or hydrocephalus, which is excessive fluid in the brain, or some deformity like scoliosis or abnormal bend in the spine. So we have a huge experience with our team in dealing with these. Unfortunately, again, the outcome depends on how bad the abnormality is. In a severe abnormality, we cannot do much against nature, because that is how they are designed, that's how they are born. Second thing is, when it comes to what we can do after surgery, again, rehabilitation plays a major role. Unfortunately, these children are born in underprivileged families, low-income groups, and this is mainly because of during pregnancy, they're not taking the proper vitamins, the nutrition, and there are so many factors which are there, which the children are born to, low-income group families, and also they are not picked up during early scans. So their facilities for scans, the rural area is not as good as in the urban setup, so the children are not aborted if they have an abnormality. The 20-week pregnancy scan picks up abnormalities, and if it's severe abnormality, we recommend that they get aborted. But if it's missed in that scan, then they continue to have the child, and then we operate, and then we have to struggle with this child. So this is a very big topic, it's a big area, but we specialize in that at Hamsa and at Kauvery Hospital, and fortunately with the help of the Tamil Nadu government as well as with Rotary clubs, we provide a lot of free surgery to these children.
Unfortunately, sir, we are almost coming to the end of our Google Meet. Would you like to talk about the collaboration with the Global Rainbow Foundation?
Yes, yeah, definitely. So, I was introduced to Global Rainbow Foundation during the pandemic, almost about a year and a half ago, and we have done a lot of interesting work with the Global Rainbow Foundation, and the first thing that we started off is academics. We were exchanging a lot of academic programs, training therapists. Then we also saw a lot of patients that Dr. Armoogum, Parsuramen had sent us. We saw a lot of patients. Some of them are waiting to come for surgery. So I think we want to really go forward in how we want to collaborate. And I personally feel that Kauvery Hospital and Hamsa have to move. We can operate on patients, we can provide diagnostics as well as therapy for patients, and we have the expertise, we have the specialists, we have excellent infrastructure here, but the experts and the specialists can come to Mauritius. We can stay for a few days, we can operate, we can consult patients, but obviously we need a good platform. So I'm sure Global Rainbow Foundation can take this up, and we can create a nice hospital setup where patients can benefit, and we can have a regular training program for rehabilitation, a training program for doctors, and I think the Mauritius is a country that's growing, economically, and in terms of everything it is growing, and I think such collaboration will help. I'm sure there's already lots of ties with India, with Mauritius, and I know a lot of doctors, hospitals that visit Mauritius already. They're doing a good job, but I think we can be part of this growth, and we can contribute a lot, and we can be a part of your system, and we are open to suggestions, and we're open to collaborate.
Well, Professor Parsuramen will be more than happy to take this up, and you, as the founder, president of the Global Rainbow Foundation, you're looking forward to this collaboration with Hamsa Rehabilitation and Kauvery Hospital.
Absolutely. Thank you very much, Dr. Balamurali. In fact, in initiated the discussion when I was in Chennai, and I'm glad that you mentioned it again. I'm glad you mentioned it, and well, we will seriously discuss that when I'm visiting Chennai again in early June. But we would like Dr. 𝐊𝐿𝐾𝐨 and myself, and if possible, we'll connect with you to have a preliminary discussion about how can Hamsa Rehab be have as an antenna in Mauritius, you know, and this together with Global Rainbow Foundation will provide service to the Mauritian population, and many of them would need that very specialized and also very caring service to them, so that we can give them good hope for a healthy life. So this discussion, I'm very keen on that, and we will discuss and explore, and we'll certainly facilitate it. I am having some consultation with some other private clinics, whereby we can tie up with them, you know, so that we can do this, we can do some operation in Mauritius, right? All these are things that we can plan, and certainly having a collaboration with Hamsa and Kauvery Hospital in this area will be of great benefit to the population. So we'll work towards that. And we also, yesterday, we had a very, very interesting CPD or CME, you call it, in India, you know, for the doctors. When Dr. 𝐊𝐾𝐨 offered that, they gave that talk yesterday, so the 40 doctors were present, and they really appreciated and found that the talk very, very useful and interesting for them. So I mentioned about possibility for you on your next, your future visit to Mauritius, that you could also conduct a CPD for the Mauritian doctors, and more than that, we can then launch something very important in terms of our future collaboration. So thank you very much, Doctor, for taking time to be with us this morning. Again, I apologize for the minor technical problem we had, but we'll make sure that next time it's perfect. And if we do need you, you know, for this sort of exchange and intervention, I think we'd appreciate if anything, give us 30 minutes of your time. You know, we would like to have that sort of program as and when we feel it's appropriate. So thank you very much. And I will also take this opportunity that Dr. 𝐊𝐾𝐨 is doing a fantastic job here, and we'll make sure that he doesn't only work. He can go to the seaside, he can visit some places, and he's been to temples yesterday, so you will certainly have a complete visit. Thank you very much, and I look forward to talking to you again and to see you in person early June when I'll be in Chennai. Thank you.
I'm sure Dr. 𝐊𝐾𝐨 would like to add a few words.
Yes, I strongly believe that the collaboration between the Global Rainbow Foundation, the Kauvery Hospital, Hamsa Rehab will do a commendable job for the welfare of the people in Mauritius. We are very happy to associate with GRF. Really, I would, with all of my heart, I should say that I enjoyed the stay. The people are very cordial, the country is very beautiful, and at least for the serene beaches, I would request Dr. Parsuramen to set up a branch of Hamsa Rehab in Mauritius.
So just for the beaches?
Everything, serene beaches, delicious cuisines, the cordial people, every positive things are there in Mauritius. Just for these reasons, and to serve the people of Mauritius, I request Dr. Parsuramen to set up a branch of Hamsa Rehab in Mauritius. Really enjoyed the stay here. I really extend my heartfelt thanks to Global Rainbow Foundation and the people of Mauritius for making me being happy here. Thanks again.
Thank you very much, Dr. 𝐊𝐾𝐨. Dr. Parsuramen, the last words.
Yes, please. Yes, yeah. First of all, thank you for inviting me. It's a real pleasure to connect with you digitally. I think technical problems we have more in India than you have. To answer Dr. Armoogum Parsuramen. Definitely, especially personally, I enjoy teaching. I enjoy sharing knowledge because I think that is what knowledge is all about, is to share to as many people. So, anytime you want us to connect with your doctors, with your team, we are more than happy to share what we know. And Hamsa is also very committed. We have some excellent therapists, well experienced doctors, therapists who can share with your therapist. I think the way that I think we should go forward is to take academics and training and teaching along with clinical work and patients and community service, because they're both equally important. Because today I might be here, I may not be there, but the academics and the training will leave behind a lot of knowledge to the younger generation. Because if we get old, we have to be treated by them. So we really have to make sure that we train our junior people. And definitely Hamsa is really keen. We are expanding in a big way in India, and we'll be very happy to come to Mauritius. I've never visited Mauritius, but it's always been my dream destination. When I was in London, there are a lot of British people. They always go to Mauritius is their one big wedding, honeymoon, or big destination. And my wife always kept saying that, but somehow it never happened. But now I have a reason to come to Mauritius and even collaborate and set up something. So definitely it's an opportunity for us as well. We are learning from this, and now that the world is all digitally connected, thanks to COVID, we can do so much help being so many miles far away. We are actually in one of our new centers that we are setting up. We're setting up a separate digital platform. How we can easily connect. Just sitting there, any therapist, anybody can see a patient and can give an advice. Because that's very important as well. Because even though doctors visit, they can only come for short periods. But this should be ongoing, and we should create a system where we are able to be there. So looking forward to this association, and thank you all very much for having me here. And Dr. 𝐕𝐢𝐧𝐚, please to enjoy the Mauritius and the food and the beach and everything else. Have fun.
I want to share with you in confidence, Doctor.
Yes.
With you, Dr. Balamurali, in confidence, that I go and pick Dr. 𝐁𝐚𝐥𝐤 at 6 in the morning, then we go to swimming together. And that's
very nice.
really refreshing and wonderful. And then you got the full energy for the whole day. So I would like to extend an invitation to you, and also Mrs. Balamurali, both of you could come. Honeymoon will not be celebrated only when you just get married. It can be celebrated for many other occasions. So do come to Mauritius, and you will really will be very happy and blessed also to have you with us. And you will also help to consolidate the partnership that we have. And I'm looking forward to that very much in the near future. So we hope your visit will be in 2022. Right?
Sure. Thank you so much.
Plan something during that year so that we mark the collaboration in a very sound footing. Thank you.
Thank you.
Well, thank you very much, Dr. Balamurali, for your precious time. We really appreciate that. I would like to thank Dr. 𝐁𝐈𝐴 as well, and thank the founder president of the Global Rainbow Foundation, Professor Armoogum Parsuramen. And of course, thank you very much to all our viewers, and have a nice day ahead.
Thank you, Vinay. Thank you. You did a good job.
Thank you.